Did Robert F. Kennedy Jr. just cross the line from policymaker to surgeon, or are we witnessing the birth of a viral myth designed to distort reality? Reports have been circulating at breakneck speed, suggesting that the newly appointed Health and Human Services Secretary didn't just visit the Cleveland Clinic, allegedly took the controls of a robotic surgical arm during a patient's heart operation. It is a story that sounds like something out of a science fiction novel, yet in today's polarized political climate, it has been treated as absolute gospel by many. Before we continue, if you want to stay on top of everything happening in US politics, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you don't miss out on these critical updates as they break. So, here's what we know. The Cleveland Clinic, a global leader in cardiac care, recently hosted Robert F. Kennedy Jr. as part of a tour to examine the intersection of high-end medical technology and public health policy. However, shortly after the visit, a firestorm erupted on social media. Claims emerged stating that Kennedy had been allowed to manipulate a robotic arm used in a heart procedure, effectively operating on a patient. Given his high-profile position as the head of HHS, a role that demands an immense level of public trust and regulatory oversight, the allegations were immediately viewed through a lens of extreme controversy. Critics were quick to point out that unless he is a licensed surgeon, such an act would be a catastrophic breach of medical protocols, patient safety standards, and legal liability. The response from the Cleveland Clinic was swift and direct. In a statement aimed at quashing the rumors, the hospital clarified that the report was fundamentally inaccurate. They maintained that RFK Jr. did, in fact, visit the facility, and he did observe a robotic heart surgery while he was there. However, they explicitly denied that he played any active role in the operation. According to the hospital, he was merely an observer, standing back as the professional medical staff conducted the procedure. They underscored that at no point was the surgical equipment under his control, nor was there any interaction between the secretary and the patient. So, what does this mean for the administration and the public's perception of Kennedy? This incident is a perfect microcosm of the post-truth era we are living in. When a high-profile figure like RFK Jr. visits an institution, every move is dissected, analyzed, and often amplified by partisan actors looking to frame the narrative. For the administration, this is a distract-iona high-stakes game of he said, she said that pulls focus away from actual policy discussions regarding healthcare reform, drug pricing, and public health initiatives. The fact that this story gained so much traction so quickly suggests that there is a deep-seated public appetite to believe the most sensational versions of events. It shows that people are looking for reasons to either celebrate Kennedy's hands-on approach or condemn his alleged recklessness. Ultimately, the outcome of this situation is a clarification that brings the temperature down, but it doesn't solve the broader problem. We are in a climate where the line between a political stunt and official duty is increasingly blurred. If the public cannot trust the basic reporting of a hospital visit, how can they trust the complex regulatory decisions coming out of the Department of Health and Human Services? This incident serves as a stark reminder that in the world of modern politics, optics are just as powerful as policy, and a single rumor can spread faster than the truth can ever hope to travel. The Cleveland Clinic has closed the door on this specific story, but the fallout and the questions about how we verify information in the digital age is likely just beginning. So, what do you think about this? Do you believe the hospital is telling the whole truth, or do you think there is more to the story that they are trying to cover up? Drop your opinion in the comments below. I read every single one, and I want to hear your perspective on whether this was just a simple misunderstanding or a deliberate attempt to manipulate the narrative. Politics is moving faster than ever, and as we've seen today, the details matter more than the headlines. We will continue to track these developments as they unfold, bringing you the context you need to cut through the noise. Thank you for tuning in to this breakdown. Stay sharp, stay informed, and I will see you in the next video.